Okay, so now we're covering the treatment of mood disorders. So first, psychodynamic perspective. Psychodynamic perspective states that depression is due to a massive defense mounted by the ego against internal conflict. Okay, so there's conflict going on, and depression arises when one loses some kind of love object. And this love object can be a parent, particularly a parent toward whom the child has ambivalent feelings. And then the child experiences positive feelings because they have lost this love object, which gives rise to guilt. The negative feelings give rise to intense anger. You turn that anger inward. It produces self-hatred and despair. More modern theorists have since revised this theory, stating that depression is rooted in a very early defect, and there's some kind of wound that is reactivated by a recent setback or blow and personal experiences as a result of this infantile trauma. And then regression leads to hopelessness and helplessness. From a behavioral perspective, then, we are looking at some kind of extinction. So the individual receives very little positive reinforcement because of several factors. So from a behavioral perspective, these individuals show very aversive social behavior. So they are likely to elicit very negative reactions from other people because of the way that they tend to interact. So they don't have very good social skills. They don't know how to interact with other people. And then these individuals experience negative reactions from other people. They're basically shunned by other people, and this reinforces their depressed mood. Their poor social skills that help to maintain their depression. So from a behavioral perspective, then, we treat depression by increasing reinforcement and social skills. So we want the client to learn how to interact with other people. We want the client to become more active, to be exposed to more social reinforcers in the environment so that they experience a positive reaction by interacting with other people. And then this positive reaction will help address their mood. A cognitive perspective looks at the way that we interpret what's going on around you, particularly looking at interpretations of helplessness and hopelessness. So individuals who are depressed often believe that they are powerless to change the situation. They believe that they don't have any control and that things will never change, right? They have very little hope for things to change in the future. So they might develop this learned helplessness where they believe they have no control over how the future progresses. They tend to have a very negative self-schema where they see the self, the world, and the future as negative. They have this negative bias where you see yourself as a loser, thinking that I'm a loser, nothing will ever change, the world is against me, nothing will ever get better. So then in terms of treatment, we want to change the way that you perceive yourself, the world, and the future. So we want to change the statements, the talking that you do to yourself. So you want to say things like, all right, so how likely is it that things will never change? Am I a complete loser? Probably not. There's probably something going on in my life that is good, right? That shows that I am not a complete and utter total loser. Maybe saying things like, well, it wasn't my fault. It was the situation that was stacked against me. So a number of techniques that you might use in cognitive treatment. You might do an automatic thought record, which I'll show an example of in just a second. You might have the individual schedule out activities. So if this person is busy, they have less time to think about how awful everything is around them. And you might also have them work on setting real and tangible goals. So let's look at this particular thought record here. So in the thought record, you want to describe the particular situation, the emotions, the thinking that you tell yourself, and then you have the client basically weigh the rationality, the evidence for and against that particular belief, and then look at the particular outcome. So let's say that my situation is that I believe I am a complete and total loser because I call my friend and I get her voicemail. So I think that she is avoiding me because she knows that I'm a loser. Okay, so I call my friend, I get her voicemail, that's the situation. The emotion, I feel really, really sad, right? I feel really upset, and maybe that is a 90 on a scale of 1 to 100 for me. The automatic thought is, my friend knows I'm a loser, and that's why she's avoiding me. Rational response to that thought. Okay, what else could be going on here? Maybe my friend is busy. Maybe she's out of town. Maybe I called her when she was at work, and she'll probably call me later on when she's not so busy. So now I need to look back and see my automatic thought. Am I a total loser? Is my friend avoiding me? Probably not, right? She's probably got something else going on, and that is the real reason behind her not picking up the phone. Okay, so a sociocultural perspective then looks at society and culture and looks at how different groups experience depression. And so the sociocultural perspective states that things like poverty help to explain why ethnic minorities might experience depression at higher rates than ethnic majority groups. So then to treat depression, we need to attack these social problems that underlie depression and suicide. So things like teen pregnancy, substance abuse, gun control laws, juvenile delinquency, all of these things need to be addressed in society at large if we want to affect change at the individual level. Other things that we might look at in assessing mood disorders, you'll see that there is the Beck Depression Inventory, which I have included as part of the resources for this chapter. So the Beck Depression Inventory, or the BDI, is something that you can use to very, very quickly get an assessment of your client's mood. You'll see that the questions are pretty obvious, right? It's very obvious what these questions are directed at. Things like, how often do you feel extreme sadness? I've thought about killing myself. These have face validity. It's really, really obvious what they're getting at. And you'll want to give these each session to your client so that you can track improvements in mood over time. Biological perspectives look at genetic research showing that mood disorders tend to run in families. We can also look at one theory of depression in the biological realm that looks at imbalances in neurotransmitters. So remember, neurotransmitters are those chemical messengers in the brain. And according to these theories then, these neurotransmitters are out of balance. And so to treat them, we can use antidepressant medications. Antidepressant medications basically directly attack neurotransmitters in the brain. There are several classes or classifications, specific types of antidepressants. So MAOIs, monoamine oxidizers, these are used infrequently now because they tend to have some pretty nasty side effects that individuals do not really like to deal with. Tricyclic antidepressants, another classification of antidepressants, they're effective, they're used less frequently, compared to the SSRIs because the tricyclics have a high potential for overdose, and oftentimes they take a while to actually start working. So the most commonly prescribed are these selective serotonin reuptake inhibitors, or SSRIs, which basically work by increasing the availability of serotonin. So serotonin is that neurotransmitter that is directly related to mood. And so selective serotonin reuptake inhibitors increase the salience or the availability of serotonin, allowing it to bind to the receptor sites. And that's the way that it actually can improve mood. Looking at treatment of bipolar disorder, there are several different kinds of treatment. Most common is the use of lithium carbonate, which is a mood stabilizer, most commonly used to treat bipolar disorder. Lithium carbonate as a mood stabilizer has some side effects that come along with it. So lithium can be toxic to the person. So it's very, very important that if you're on lithium, you get regular blood tests to measure the presence of this drug in your body, or it can have some pretty serious side effects. You might also use anticonvulsant medications, so things like Depakote, Tegretol, or Lamictal to treat bipolar disorder. You might use atypical antipsychotics such as Abilify or Chlorazil. When individuals don't respond to lithium, you might choose one of these antipsychotics instead. Zyprexa is another example of an antipsychotic, helps with severe or psychotic depression when these individuals have that break from reality, right? When they experience these delusions or hallucinations. Or antidepressants. So you might use something like Prozac, Paxil, or Zoloft, but it's important to note that if the individual has bipolar disorder, they would never take this antidepressant by itself. Because if you give an individual with bipolar disorder just an antidepressant, this can cause a rapid shift into mania. So you would never, ever, ever just have an individual with bipolar disorder taking an antidepressant. It would always be coupled or paired with a mood stabilizer or an antipsychotic. Additionally, electroconvulsive or shock therapy, something else that might be used to treat severe cases of depression. And ECT, electroconvulsive therapy, is often used as a last result. So you've tried everything else and nothing seems to work to treat your depression. So you might then choose electroconvulsive therapy. We're not really sure why ECT works, but it can often be very effective for individuals who have severe depression. With ECT also, it's important to note that it's not as though you just get one session of ECT and you're finished. Oftentimes these individuals have to go back repeatedly for electroconvulsive therapy. One of the side effects of ECT is that sometimes there's memory loss that is associated with this particular form of therapy.